Welcome again. There is a great deal of information to get through today, so to give plenty of time for questions, we will extend this press conference to up to 2:30 if we need to. The Bailiwick is in a very strong position today with 15 consecutive days with no new positives and being down to 7 active cases. And thank you to everyone for working so hard and working together in the spirit of Guernsey Together to deliver that fantastic position. As a consequence, the Committee for Health and Social Care have this week decided that we can move into Phase 3 starting from 1 minute past midnight tonight, a week earlier than originally envisaged in the exit framework, and Deputy Salisbury will provide the detail in a few minutes. You will have many questions, I'm sure, following today's announcements. And as ever, we may not have all the answers either today or even after today. So please do use all helplines, but do bear with them as well, as they will be busy over the next few days. And the Chief Executive will talk about how we're planning to staff that up to cope with those questions, but we will expect them to be busy. If we can maintain our success, there is every reason to believe that we can concertina the phases that follow, which would obviously be a fantastic result for all of us. Now, the message elsewhere is clearly changing. In England, you are now advised to stay alert. In the Isle of Man, you are now advised to stay safe. And I would obviously advise, please feel free to do both of those. But I want to be very clear, even though we are easing out of lockdown and you will be able to do more, firstly, that does not mean that you have to do everything that is permissible. And secondly, the central public health messages that we've heard for several months now have not and will not change. So wash your hands frequently, don't touch your face, keep 2 meters distance from others, go shopping on your own, not with others unless you absolutely have to, and yes, stay at home. You can go out to exercise and or you can move from your household bubble to your work bubble if you are unable to work at home, but then you return to your household bubble. So stay at home remains key for all of us as much as we possibly can. I said last week that we would say something about education this week. More detail is set out in a dedicated press release today, and much more information will follow from education next week. But what I can say now is that the Committee for Education, Sport and Culture have decided that for primary schools, from the 8th of June, students will be able to attend schools on 2 days each week. Approximately half of the students will attend on Monday and Tuesday, with the other half attending on Thursday and Friday. Siblings will be kept together. Primary schools will close on Wednesdays for deep cleaning and for teachers to develop home learning for students when they're not in school. Vulnerable students and children of essential workers will continue to be supported on the 4 days that primaries are open, if needed by their parents, so please do discuss that requirement with your schools. Primary schools will contact parents directly during half term to provide details on how it will operate at each individual school. Secondary education will continue to be delivered by distance learning for the time being, as the advice from secondary school leaders is that this is the best option educationally whilst complying with public health guidance. And vulnerable students and children of essential workers can still attend as they are now. In the last week, there has been much talk about the R number, the rate of reinfection from the UK to Germany. There's been lots of speculation about what it currently is from Jersey to Japan. We don't actually have an R number right now, simply because we've not had any new infections to provide the data for public services to calculate what that number might be. Now, at the outset, you will recall the objective of lockdown was to flatten the curve. And you've also heard Nikki subsequently say that, in fact, we've managed to crush the curve, exceeding all expectations. And that has given rise to talk of the elimination of the virus from the bailiwick. And Dr. Brink can answer questions about the challenges of defining elimination and what that actually means within a geographic area. But it would be a perfectly reasonable challenge for you now to be asking, well, when did the objective change? When did it move from being flattening the curve to eliminating the virus? And let's be clear, the strategy is and remains, as it has all along, test, trace, and isolate. And the consequence of our success in applying that strategy is that we can realistically aim to eliminate the virus in the bailiwick now. And I want to explain why that now may make sense for the economic life of the community. Our initial economic modelling indicates a reasonable expectation of a contraction of the economy this year in 2020 of 9 to 10%. And that's a loss of economic output of around £330 million this year. And actually, as an aside, without any intervention by virtue of any recovery strategy and the plans that follow that, we estimate that our economy would not be back to its pre-COVID size until 2027, which emphasises the importance of developing a recovery strategy. But by comparison with some other economies, our estimate of economic contraction actually is relatively low, and that I think reflects, as it does, the dominance of our financial services sector in our economy in comparison to others, and its ability to continue, largely, to trade through the crisis so far, and I think we absolutely should thank them for that. However, we estimate that a worst case, in other words, a slow exit followed by a second wave and a further lockdown, could see that contraction double. So the stakes are very high, and we need to get our exit right. And for that reason alone, for the economic reasons alone, quite apart from the public health reasons, managing the exit in a series of measured and controlled steps through the remaining phases makes much more sense than a single leap to reopen the economy in one go. In short, the reality is that actually much of the economic output has already been lost, and much for some of the sectors, including, of course, particularly the inbound visitor economy, is not going to come back for much of this year anyway, whatever we do. So the marginal gain of a single step is simply not worth the downside risks of that approach. We've had the economic pain, and we must not now squander the very real and visible gains by moving too fast now and risking even more economic damage later. Our approach should enable us to effectively reopen the whole internal economy within a few weeks. I've said all along that I will level with you, and I will do so again. I just simply don't know, and I think no one does, whether we have got the speed of our exit right. Is it too fast or is it too slow? Should we be allowing more or fewer types of business to restart? And everyone is going to have their own personal view on that. And the picture is even more confusing when you start to look outside the island. Every jurisdiction is doing their own thing, doing something a bit different. You can actually get a haircut in New Zealand today. Bars in New South Wales can have up to 10 customers in them. There's alfresco dining in Jersey. You can drive to a park in England but not in Wales, and so on. And the reality is it's only going to be in 2 to 5 years from now, when lots of researchers have produced lots of academic work on this from all around the world, looking at all the different approaches. Is it going to be possible to judge whether our decisions today are the right ones or not? And frankly, even then, I suspect those papers probably won't all agree. So we're now at the stage of making difficult subjective political decisions. And not everybody will like them, especially if they can't do what they want to do. But what I can say is that these decisions are being taken on the back of the best currently available, and that is a very important caveat, currently available, advice and data. And I asked you to trust us on the way into lockdown, and I ask you to trust us again on the way out. And when our decisions are judged in the future with the benefit of hindsight, in the big picture, frankly, it won't really matter whether we decide to allow nail bars to open next week or next month. What will matter is, did we manage to save lives? Did we prevent our healthcare system from being overwhelmed? Did we mitigate the economic damage? And did we enable as swift a recovery as possible? And I hope that the answer to each of those questions will be yes. But frankly, those judgments simply cannot properly be made until this pandemic has passed. I just want to say a quick thank you to all those who have contributed to the appeal funds. The COVID-19 response appeal is currently standing at £90,000 and the social investment fund appeal stands at £140,000. So on behalf of both, thank you so much to everybody who's contributed to those. And finally, before I pass to Dr. Brink, I want to pay tribute to the other islands of the bailiwick. Herm, Alderney and Sark have all remained, of course, blessedly free of coronavirus. And though, of course, they're separated from us, you too have been very connected to our shared community commitment to the bailiwick's strategy. And, of course, you too have suffered the same privations and impact as Guernsey. And so I'd like to take this opportunity to thank you for your hard work, sacrifice, and your own island's community spirit. So thank you. Over to Nikki, and then we'll pass to Heidi.
So thank you very much, Deputy St Pierre. So as Deputy St Pierre said, we're in a really good place. We reached a milestone when our first test run came off this morning, our first run of tests, and that we've now done over 4,000 tests in the bailiwick. So really, really impressive from that point of view. We remain at no new positives on day 15 of no new positives. We have 252 cases, so that's remained stable. And we now have only 7 active cases. So everything moving in the right direction for us. So I think from that point of view, it's really positive. What we're seeing in the community is we're not seeing very many cases of respiratory type illnesses, loss of smell, loss of taste. So we've got very little activity in the community. So what we've actually done is moved forward some of our expanded testing program. So we're starting now to test asymptomatic people working in key areas. So that's been important as well. So we're moving away from testing of symptomatics only to some asymptomatic testing as well. And that, of course, relates to the direct detection of the virus, so our PCR-based assay. So we're very pleased with the progress of that. Which brings me into antibody testing, and I've had quite a few questions about antibody testing. And I think you all know that I favour the well-based assay, so the one that we can do 96 tests at a time. You may have read that the UK have procured antibody testing through a certain provider. Guernsey is going to be getting tests from the same provider. It's been a test that's been rigorously evaluated by Public Health England, and we've put in an order for 10,000 of those tests for the bailiwick. So we'll be looking at using those. As I've said to you before, we're not intending at this stage to do large-scale population-based seroprevalence because we think the incidence of infection in the island is very low. What we're doing is looking at testing certain targeted groups. So, for example, sometimes, as I've said to you before, when someone has COVID-19, they can get rid of the virus very quickly. And indeed, some of the later symptoms can be mediated by the body's own immune response to the virus. So they've lost the virus, but the body's immune system is causing some of their symptoms. In those cases, you might well see the people being antibody positive. So it'll give us an additional diagnostic tool. It's not common. We've got a handful of cases who fall into that category, but it would be nice to test such individuals. So that's the main group. The other group that we're going to look at are the contacts of known positive cases. So we're going to offer them testing as well to see if there was any asymptomatic transmissions in those groups. So very, very targeted groups. So that's with regard to the antibody testing. So the other thing I wanted to comment on is the progress to phase 3. Now, we always said that our progress and our exit would be driven by evidence, good evidence and bad evidence. What we have seen today with our progress and our recommendation from a public health perspective that we moved to phase 3, we've seen that we've actually exceeded our expectations. So if you recall, progressing from phase 2 to phase 3 meant that we had to have stable or decreasing levels of community-acquired COVID-19 infections. Actually, when we look at the data we have now, our last case of unexplained community transmission of SARS-CoV-2 occurred on the 21st of April. and we moved into phase 2 on the 25th of April. Since then, we've had no cases and no cases of community-acquired transmission. So we've exceeded our expectations in that way. Other parameters for progression were access to on-island testing. Our on-island testing is functioning very well. We have enough reagents to not only test our symptomatic people, but to extend into some asymptomatic testing as well. We've had high degrees of community compliance with all of our messaging, so that Guernsey Together brand, if we want, for want of a better word, has worked so well for us. And Dr. Raby will tell you the hospital is quiet, and linking with our GP colleagues, there's no untoward activity that we're aware of in the community. So we're in a far better place than we thought we'd be, which is why it was only right to recommend, because we're in a better place, that we actually progress sooner. So we always said we would only keep measures in place for as long as we had evidence, and I think you all know how much I love evidence, as long as we had evidence to keep those measures in place, and we've really exceeded those expectations. So the final thing I wanted to comment on was elimination. And I think here you need to differentiate between elimination and eradication. So eradication is when you permanently reduce to zero a particular infectious agent globally. Okay, so if you ask me for an example of a infection that we've eradicated globally, that of course is smallpox. So it no longer exists across the whole world. Elimination is a more narrow definition. So elimination is when you reduce to zero an infection in a particular geographical region. So we're considering the bailiwick as our geographical region. An example of a virus that we've eliminated locally, but they haven't eliminated in the UK, is measles. So those are examples for that. So that took us in the Public Health Department, and we had a wonderful couple of hours trying to define how we would look at elimination. How would we say that we've eliminated the virus that causes COVID-19? So there isn't an international definition that we could find, or a reliable one. So that took us back to first principles. And we could say, well, we've had no new cases for 15 days. Should that count? We'd argue not, because as you would see from our data, we've still got 7 active cases. So although those 7 active cases are still in quarantine, there are still people who are potentially excreting the virus on the island. So what we're thinking of doing, and we've opened this up for academic debate with various of our colleagues in the UK, is what if we looked at the last active case disappearing and look at, say, a cycle of 28 days after that? Is that a definition we could work with? So we're throwing these ideas up for discussion in the academic communities. How do we actually define elimination of the virus that causes COVID-19? What is important for us is that we actually do exit testing. So when someone is diagnosed as being positive, we don't release them from quarantine until we've tested them and showed that they no longer have the virus. Now, that's different in different jurisdictions. A lot of people aren't doing that exit testing. So we're quite confident we can do the exit testing and then work on some sort of definition of elimination. So that's going to be an interesting one, and a debate that we want to have both within Guernsey, within the whole bailiwick, but across various places in the world as to how do we collectively here and globally define local elimination of the virus that causes COVID-19. So thank you, that's all I've got.
Thank you. Deputy Salisbury.
Thank you, Gavin. As Dr. Brink has advised, thanks to the amazing efforts by the whole community, we're in a far better place than we possibly imagined we would be just 2 weeks ago when we were putting together our exit from lockdown framework. As all of us said repeatedly last week, the framework is not set in stone. It is a living document that will change and be updated based on the evidence we have and the situation we're in. And Dr. Brink has provided the evidence and justification for moving to phase 3. And so the Committee for Health and Social Care has decided that we can bring forward that phase effective from tomorrow. Before I set out what that means, I really do think it's important that, like Deputy St Pierre, I remind you what doesn't change. The key messages that continue and which must not be lost amongst the headlines of what we're announcing today. Stay home in your bubble as far as possible. Continue to work from home wherever possible. Maintain social distancing of 2 metres. Follow the hygiene guidelines. If you have COVID-19 symptoms, immediately self-isolate at home and seek medical help. And if you're returning from outside the bailiwick, self-isolate for 14 days. That doesn't mean mixing in your bubble. This is a legal requirement and you'll be committing an offence if you don't do so. Indeed, as we relax restrictions within the bailiwick, this will become increasingly important and we're going to be stepping up efforts to ensure the bailiwick bubble is strong. Okay, so what does phase 3 mean? Well, for those classes of businesses already allowed to operate, such as building and other trades, building, wholesale and supply, and vehicle sales, repairs and maintenance, we're removing restrictions on the number of people can work on a site or premises. Instead, numbers will be restricted based on how many people can work on the site and still maintain social distancing and hygiene requirements. Premises may be open to customers with restrictions on the numbers of people permitted, as currently apply in food retail, with 2 metre social distancing to be maintained at all times. The above will also apply to offices, although we're still advising people to work from home if at all possible. Now, indoor building and allied work within houses is now permitted under strict hygiene guidelines. This will be limited to 2 people unless the house is unoccupied or health and safety guidance requires otherwise. This doesn't currently apply to domestic cleaning, but I can say that consideration is being given to the potential development of further specific guidance. In addition to the above, takeaway food services, including those provided by restaurants and hotels, can commence taking pre-orders only, and with collections permissible subject to conditions. Childminders may now provide a service to essential workers. However, those who work in their own home with several children from more than one household, including their own, cannot work as this mixes several households unless the households are bubbled together. It's also important that where any child is showing COVID-19 symptoms, they shouldn't go to a childminder and medical advice should be sought. Now, whilst public venues such as museums, libraries and gyms must remain closed, places of worship can open for private prayer. In addition, a maximum of 10 friends and family can now attend weddings and funerals, although I'm afraid receptions and wakes are still unable to be held. Public toilets will also be opened, which I'm sure will be a relief for some. There will be no changes in recreational time as we start phase 3. However, we are saying that bubbles can now contain 4 households. So, an existing bubble of 2 households can join with another bubble of 2 households, as long as they all agree to it. A bubble of 2 households could join with 2 other single households, or 4 single households could bubble up. The important thing here is that households can't change those that they have already bubbled up with, and the maximum number of households that can bubble up is 4. Finally, in relation to the changes being made now, we're going to pilot the opening up of non-essential retail. We want to do this so we can test how things go, see how it works, before opening up further. So from tomorrow, we're allowing garden centres, cycle shops, sports shops, and shops selling clothes and shoes for children to open. As before, businesses will need to notify the states that they intend to operate and provide details as to how they will comply with the guidance, all of which can be found on the coronavirus website. I think it's also important that I ask everyone to have patience. It may be a good idea not to rush to order a takeaway or go to the shops immediately. Some businesses may not be in a position to be able to open straight away. Unless you really have an urgent need for something, just allow time to let things settle down a bit. Now, those changes will be effective from midnight tonight. However, we also think it's important that we look ahead, given the position we now find ourselves in. So, on the basis that things continue the way they have been, we're looking at potentially making further changes in 2 weeks' time. This includes enabling outdoor dining and the opening of beach kiosks, as well as increasing recreational time and a further change to bubbles. In making our decisions, we have balanced the risk of the virus to our community against the wider health, social and economic impact on islanders. There is no right answer. We know for some it may be felt we're going too slowly, and for others too quickly. However, I would just like to assure you that we have given this an incredible amount of thought, working very closely with Dr. Brink and her team, as well as feedback through the new COVID-19 Recovery Advisory Group. And finally, I can't emphasise enough how important it is that we don't get complacent. Just because we aren't picking up positive cases doesn't mean that there are no cases out there. The longer we all keep to the public health messaging, the more likely that is the case. But there is absolutely no guarantee that is the case now. If we get complacent, that is how the virus will most easily be spread, and we will end up going backwards, not forwards. Our planning is contingent on everyone staying strong, as you have done for so long now, and that has put us in the position we are today. So let's continue to be proud to demonstrate we remain Guernsey together.
Thanks, Heidi. Paul.
Yeah, just following on from that, as already noted, we are moving into the first stages of Phase 3. Details of what this means for us all will be published online during this briefing. This will mean that more businesses can start operating again over the coming days and weeks. If, having read the criteria, you think this applies to you, then you will need to notify the environmental health team of your intention, just as those already working have done. If you are already notified environmental health, you do not need to do so again. Please take into consideration that these measures are put in place to ensure we continue to make this excellent progress. If you're unsure as to whether you qualify, then please make sure you speak to the environmental health team before doing so. This positive progress is excellent news, but there continues to be a need to support the economy. So far, we have supported 2,015 local businesses, with more than 1,000 claiming through the payroll funding scheme, and payments now reaching £7 million. A further £5.3 million have been paid out in the form of grants, totalling over £12.3 million of payments to date. This equates to over 6,000 employees in Guernsey being assisted with the provisions of pay by the Business Support Scheme. As previously mentioned, we have had issues with the running and operating of a manual email-based application process remotely by individual caseworkers, which has meant payments and claims are taking longer than is satisfactory to be processed. As promised, we have been working on building a digital solution with our partners Agilicis, and I am really pleased to say that by the end of this afternoon, businesses can apply for payroll support through the Business Support Scheme, which will be able to submit their claims through a new online digital portal. This new IT processing scheme will enable faster processing and payments of applications, and importantly, will allow us to track and monitor your applications more effectively. If you've already submitted a claim, you do not need to do so again through the new portal. There has also been some changes made to the qualifying criteria, and eligibility for funding has been widened for certain businesses. In particular, small businesses employing up to 20 people will now be entitled to claim a small business grant, and companies that have multiple businesses in different economic sectors can make a separate claim for each of those businesses. Details of all the changes to the business guidance is now available online. If, having read this guidance, you can consider your business to now be eligible to claim under these new revised criteria, all details of how to claim are in those guidances. Please remember that some businesses may be more prepared to open than others, and some may not choose to open or indeed meet the criteria. Equally, some businesses may not be operating to their normal level of operation. This is going to be a gradual process, and so we would all need to be patient. If you have any questions or details or queries on the changes to these restrictions, it's important they are directed to the right staff that can answer your queries. Please avoid sending general queries directly to Deputy St Pierre and Salisbury, and particularly Dr. Brink. There will be people online, and we'll have people online over the weekend to answer your calls. Thank you.
Okay, thank you very much, Paul. Dr. Raby.
Thank you. I'm delighted the spotlight isn't really on the hospital at the moment, but I'm going to give you a brief update on where we are with things. Dr. Brink used the quiet word. I get told off when I go back and use that word because doctors are quite superstitious about that word, but I'm not. Just because areas of the hospital have been quiet doesn't mean that people haven't been working hard. And I'd just like to mention some of our wards have been working ever so hard throughout this entire thing. So our rehabilitation ward, the Marchant, has been full throughout the entire period. And I just think, they've been having to work ever so hard with all the restrictions about COVID that they have to deal with. So just a quick mention of that. The imaging department and X-ray departments are seeing a lot more people now. We're seeing a gradually increasing numbers through the emergency department as well. Next week, we're dipping our toe in the water of planned and elective operations. It'll be a slow start because we're still taking full precautions for the personal protective equipment, and we have to do the deep clean between patients still. But we hope soon after that we can move back towards more normal working in theatre, and perhaps in a couple of weeks start increasing our flow through the operating theatres, and perhaps think about things like something we've had a lot of questions about, when partners can attend with their mums-to-be for a caesarean section, that sort of thing. So we know that's on your radar, and as soon as we can, we'll be giving you news about that when it's safe to do so. Things we always talk about, personal protective equipment. We've got at least 3 months supply in every line now, and we're seeking to increase that further, because if we get a second wave, we'll be needing all of that. But we're in a good place for that at the moment. So that's more or less the hospital position. Moving on, care homes. We only have one patient left in the hospital now who's from the care homes who's still testing positive. It sometimes takes a long time, as Dr. Brink has said, for especially elderly people to completely eliminate the virus. But that's a fabulous position, and probably while we're talking now, I think one patient who's finally tested negative is going back to one of the care homes that was previously affected. So good news there, and I know the care homes will want to get their residents back to sort of more normal out of the room activities and things as soon as they feel it's safe to do so. So I'm going to say, only positive news at the moment about the care homes, which is great. Primary care continue to work closely with us. You'll remember that throughout this time I consider their input to have been exemplary in terms of how they've helped us in the care homes, how they've divided the heart clinics and worked at the chest and heart clinic doing testing with us and offering support, and we've had a lot of help from them. So we continue to work closely with them. I think that's enough from me. Thank you.
Great. Okay. Thank you very much, Peter. Okay, we've opened up for questions. As I say, given that we've covered quite a lot already, we will extend if needed. So who'd like to kick off, please?
Rosie Alsop, Island FM. Can you tell me where community centres will fit into this moving into phase 3, particularly those that do activities that concentrate on the well-being of the population, social prescribing, that kind of thing?
At this moment, public venues, which I would say would include community centres, won't be opening. But again, things are moving at a fast pace. If things go well, we might be able to see that in the next few weeks, but certainly not in this stage.
Okay, thank you.
Dr. Brink, if we are working towards elimination as an island, what does that mean for then eventually opening up to the rest of the world? Because obviously other places may not have been able to eliminate it.
Yeah, I mean, that's a great question, and something that we have spoken about in great detail. So the obvious thing would be the development of a vaccine, so providing some protection to the local population. The second arm that people are looking at is the development of effective treatment for the viral infection. So that would be the other issue that could be considered. So there are various drugs that are being trialled at the moment, remdesivir, various other drugs. And then the third thing is if the infection burns out in neighbouring jurisdictions. So we will be looking at what the risk of infection is to islanders and how we can mitigate that risk. But actually, other than the external risk, if we manage to get the levels down to eliminations, that we had no known cases on the island, is there would be no reason why the bailiwick couldn't carry on and function entirely normally other than external travel. And that would get a lot of sectors moving, it would get people moving, it would get children back to school, it would be all of that, and that would be really positive. The thing is, because this is a new virus, it's only just hit the human population in the last 6 months, I think I've said that one before as well, is that we just don't know how quickly we're going to get an effective vaccine, when we're going to, or if we're going to have effective treatment, and how long it's going to take to burn out. So there is a bit of a unknown there. But if we could be virus-free within our jurisdiction, it would open us up to a lot of activities.
I'm just wondering whether on the back of that you want to say anything about the fact that the rates of infection globally, in terms of the number in the proportion of the population that seem to have been affected, seems to be much lower than was originally assumed, perhaps 2-3 months ago, and what impact that has in terms of future planning for the course of this disease.
So we're all concerned about a second wave. So that has to be a concern because most of us seem to have largely susceptible populations. One of the problems is no good large-scale seroprevalence studies have been done. So they've been quite small studies. There have been extrapolations from the number of people dying and the number of people in hospitals to predicting how many people in the community have been infected. But it does seem that in most jurisdictions, the minority of people have been infected, which really has implications for future infection in all of the jurisdictions.
Great, thank you. Ewan.
Ewan Duncan from BBC Guernsey. Just to pick up on a point you said, Dr. Brink, you said we could return to normal if we can say we've eliminated the virus. Does that mean we would be able to stop socially distancing within the bailiwick? And would there be a concern if we say we've eliminated the virus, there could still be people with symptoms who are asymptomatic or simply just don't put themselves forward for testing?
Absolutely. So asymptomatic infections it will always be a concern. But if asymptomatic infections are transmitting to other people, you would expect someone to declare as symptomatic. So that then goes to our test, contact, trace, and quarantine. So if you had an asymptomatic infection and infected 5 people, you would expect at least 2 or 3 of those to be symptomatic. And you would then test them and then contact trace back. So I think from that point of view, it's not everyone's going to be asymptomatic. So you are protected to a degree by some people becoming symptomatic. So what our new normal will look like, we're not sure yet. I think this pandemic has fundamentally changed our behaviours. So I think if we can adhere to good standards of hygiene and so on, not only will it help for infection with the virus that causes SARS-CoV-2, but the virus that causes COVID-19, but also other infectious diseases, so winter vomiting disease, norovirus and so on. So I think if we eliminated the virus and we were confident over a period of time, and we'd have to monitor, the longer we had no cases, the longer the hospital had no possible cases admitted, the more confident we'd be to drop some of what we call non-pharmaceutical interventions, which is things like social distancing. And in essence, what you're doing now is as we ease out of lockdown, more people are going to be mixing in the community. So I would see a gradual progression, but I really want to caution against complacency. These are hard-fought games. We've done really well, but we've done well because the community has enabled us to do well. Public health and all of us in the hospital and so on have just been vehicles. The community are the people that have actually enabled this to happen. And I'd really caution about being too complacent, and let's move forward positively.
So just to be clear in response to that question then, even when we get to a stage where hopefully we have that island bubble, normal life has returned within the island, it is still quite likely that there will be a requirement for some of those public health guidances to be followed for some extended period of time.
Well, I would hope that some of them would become integrated into our daily life. So catch a bin, kill it, good hand hygiene and all that. I'm really hoping that some of our behaviours will be fundamentally changed. And I think that would be one of the good things that comes out of what's happened to us.
Great, thank you. Yes.
Hi, Charlotte from ITV Channel. With the decisions around returning some primary school children back, what was the decision with primary school children versus secondary? Obviously, younger children are not going to understand social distancing. We've seen pictures of different countries putting children in these sort of like zones that they need to stay in. How do you realistically ask children to social distance when they're back?
Are you able to address that?
So I think predominantly why primary, not secondary, that is an education decision. So what we've done from a public health perspective is that we've done an analysis of the risk. So this is where we are. We think the overall risk is decreasing very quickly. We've had no new cases for 15 days. And so it's a public health risk. Then it's up to the educationists to backtrack onto the public health risks. Now, I wouldn't dream of telling teachers how to run the school, just as I'm sure they wouldn't dream of telling me how to work in public health. So I think that's important. So we've provided a risk assessment as to what what we think. With regard to social distancing of children in school, of course that's a challenge. But one of the things I always say is the 2 metre social distancing is important, but it's only one of a suite of interventions. And with every calculation that we do with these non-pharmaceutical interventions, we don't calculate them on 100% compliance. So you calculate them on about 60 to 70% compliance when you look at the overall efficacy. So in addition to the 2 metres, you've got the hand washing, you've got the no fluffy toys, just toys that you can clean. You've got the deep cleaning of the school environment. So it's part of a whole suite of interventions. And you can never say something's 100% safe. You can't say that in any situation. But what you can do is make it as safe as possible. And so the 2 metres, it's an attempt to keep children 2 metres apart, but with the knowledge that whilst you'll be successful probably quite a lot of the time, you won't be successful all of the time.
Can I just add to that?
Yes, of course.
Yeah, I think what's important was the Committee for Education, Sports and Culture were very keen to make an announcement this week, as previously mentioned, in terms of the direction for opening schools. And I think, as Deputy St Pierre noted, the date for that is the 8th, which gives some time for Education, Sports and Culture have absolute intention of coming forward and providing the absolute detail of how those are going to operate. It is very complicated, as you say, and so taking all the health advice, then working with the educationalists, the schools and the committee office, they'll be providing that and coming forward very shortly with the details of how that's actually going to operate in practice.
Follow-up question. Is it mandatory that children do have to go back to school with these rules? I take it there is no option for parents to say, I'm still not comfortable with that.
I think.
Well, I would say there is, by law, there is a responsibility to provide the provision of education through the committee office. A parent has also a right on how they choose to school their particular children. Some people do homeschooling now. So, of course, and I think the very sound advice that Deputy Salisbury said, that if anybody's got any indications of symptoms, whether a child or adult or otherwise, should stay at home, and if they prevent that risk.
Okay, next question, Mark.
Mark Roger, Guernsey Press. Deputy Salisbury, I heard that last week, I think it was, 8 ventilators have been shipped to Guernsey in addition to what we've already got. Just wondering if we're actually going to need these. If not, are we going to send them straight back? Are they going to be sitting there waiting for a possibility of a relapse, if you like?
Well, I think Dr. Raby will be able to answer about ventilators and what we've got, but it's all about being prepared. We can't, and this is again, it's about not being complacent. Just because we're in such a fantastic place now doesn't mean in 2 weeks' time we are. We've got to be prepared for a second wave, which we don't want, and we're doing everything to avoid that. But it's silly to take our hand off the tiller right now and say, right, well, that's fine, let's just get, life is normal. We've got to be prepared, continue to be prepared, and that's one reason for those extra ventilators, which I'm sure Peter will be able to.
Yeah, we're delighted to have received basically 4 loan ventilators from the UK. We've got our own ventilators, which we started the crisis with. We obtained some more. We've got these 4 on loan from the UK. They initially sent us 4 that aren't suitable for intensive care use, and we were really disappointed when we opened the boxes. But we got in touch with them, and they've sent us 4 proper intensive care ventilators, which we can use if we get a second wave, and we will use, and we're going to keep them here if we need them until they're recalled. They're owned by the NHS, and they can recall them anytime they like, but at the moment they're with us. We also have 6 ventilators on order, proper intensive care ventilators that were largely funded by really generous donations, actually. They'll arrive soon, and those will be used even if not in this crisis, and let's all hope that we don't end up using them in this crisis, as part of our hospital intensive care redesign anyway. So those are part of our future intensive care, and we wanted them anyway, so we've got them a bit earlier than we would have done. So we're content with our position on ventilators.
Okay, next question. Yes, Maisie.
Sorry, just to follow up to that, is public health, I know it's hard to tell now, but is public health expecting a second wave if we are preparing?
I think we'd absolutely have to prepare for a second wave. I like to be really well prepared for any eventuality as far as I can be. And I think if we didn't prepare, I think the community could rightly ask questions of us. So it's, hopefully we will be able to mitigate against the impacts of a second wave. So the type of thing that we've developed is the Bailiwick expanded testing strategy. And that basically will allow us to identify and test very quickly. You might recall the concerns as we were going into lockdown were the fact that we didn't have on-island testing and we were limited to 35 tests a day. We now can do as many tests as we want today, and we can test rapidly, and we can also turn around those tests really rapidly. So up till now, we've been doing 3 test runs a day, so testing from early morning and taking the last run off at 10, 11 in the evening. So we've got that very rapid turnaround time, and if we needed to do that again, we could. We're preparing for a second wave. We think if you look at the modelling of these respiratory virus pandemics, there often is a second wave, so we need to prepare and need to make sure that we've not only got the appropriate resources in place from managing the viral aspects, but also things like we're planning to look at our PPE stocks. So all of these things so that we're ready if we have another pandemic. And indeed the ventilators is another example of that.
Second and even a third wave.
Hopefully not.
No, but in history of pandemics.
Yes, absolutely. Yeah. And sometimes the second wave can be worse than the first wave, so we really need to be well prepared.
No, so no complacency. Ewan.
Sorry, I was just going to ask you a question about the second wave, and you've just answered that really. But what could a second wave look like? If we can say we've eliminated it, could the second wave not be as bad, or difficult to say?
It's difficult to say, but what we have got now is we've got all of our testing in place. We kind of understand the virus now. We know what the symptomatology is. So if you think about in the early days, it was a sort of fever or cough or shortness of breath. And it soon became apparent to us there were other things going on in the community. So we learned very quickly of the other symptomatology, which is why very early we changed our case definition. So we would be more prepared in that we understand more about the symptomatology, we understand more about the consequence of the virus, we have established testing, we know that our contact tracing has served us well. So you might recall also with the contact tracing, we went back 24 hours before symptomatic. And we think that's also helped us, is that we design that program. We've got 35 contact tracers trained and ready to go. That's equivalent of 35,000 in the UK. The UK are hoping to have 18,000 trained up. So these are people who are trained and competent to go at any time. So we are as well prepared as we can be. And what we're also doing is we're looking for asymptomatic cases as well. So any seeding that could bubble up into a cluster will hopefully be able to contain very quickly. So.
Sorry, I was just going to ask you about that as well. The modelling that you're doing, are you looking at the amount of people on Ireland who might still currently have it with it be asymptomatic? And would you know from that modelling how many people have actually had it but not presented themselves?
So the only way you could actually have a look at how many people who've actually had it would be at some stage to do a larger seroprevalence survey. So in other words, do the antibody test across the island. You could also do a very large-scale test on a sort of point prevalence and see how many people have the virus on a particular day. 30,000 sample, thousands of people. So there are various ways in which you can do that. What we're doing at the moment is we're having a look at key areas and looking for asymptomatic infections in those key areas and looking at supporting people in those key areas to get testing. But we're testing for the virus at the moment in those areas. And as I say, you might get an asymptomatic case, but statistically, if you have an asymptomatic case and they're transmitting, you're going to bubble up with a symptomatic case at some stage. I shouldn't use the word bubble. A symptomatic one's going to appear. Sorry.
Mark.
Curious, what's the situation about with people coming into the island having to go into self-imposed isolation for 14 days? I mean, is that a number in the single figures daily? Are we talking about a couple of dozen a week? I mean, what's the rate?
Paul can probably answer that. There are about 15, 20 people.
20.
Yeah, 15 to 20. We have some peak arrival times, for example, on a Monday when we have maybe key workers or essential workers that we need to bring into the island. But of course, we are monitoring that very closely all the time. We are looking at how we might improve how we monitor and safeguard against the travel. We know that was our weak point at the start of this, so we're very keen to keep a very close eye on that. And we're looking at ways we can improve upon that all the time. But that's why it's essential that we do keep that 14-day period isolation for arrivals at this moment in time.
Okay, thank you. Next question. Any others? Yes, please.
Kit Gilson, ITV News. Question for Dr. Brink. Just a bit of clarity, really. Of the 4,000 tests, or over 4,000 tests that we've done, is that individual tests or tests of individuals?
It's individual people. So if we looked at the number of tests we've done, and we actually thought we should publish that because it'll be a lot more. So, for example, if someone's tested positive, we will then test them on day 14. If they're positive, we might test them again. We will test them again. Also, some people have had more than one set of symptoms, so they might have one set of symptoms and 2 weeks later have something else. So it's individuals, not test numbers. So these are 4,035 individuals that have been tested.
Ewan.
Question about the antibody testing you mentioned. You said you've ordered 10,000 kits. What does that actually mean, and who will be prioritised for those tests?
So in the first instance, we're going to prioritise contacts of known cases. So we've got our 252 positive cases. So we'll offer some testing around those contacts. So that will be important. The second group we'll prioritise are people who've had symptoms suggestive of COVID-19 who actually have tested virus negative. Now, you might say, well, why they're over their symptoms and so on. For a lot of people, they'd like to know what their diagnosis was, so we'll be working with those groups of individuals. And then what we will do is go and offer testing to some key groups that possibly have had will have had high exposure to COVID-19 in the peak of our activity here. So it would be start off with contacts of known cases, symptomatic people who've had a negative diagnosis, go on to key groups who we think are at greater risk of potential exposure, and then possibly later on doing something on a wider population base. So it'll be a stepwise progress through there. We wouldn't go for a broader population base at this time, because the other duty we have is to work cost effectively as well, and we think that the rates of infection are very low, and we'd rather focus our efforts on direct viral detection rather than a big antibody survey when we think our rates are very low.
Okay, thank you. Next question. Mark.
Me again. It's probably for Dr. Rayleigh. We've heard that the day patient unit may well be opening in a week or so's time. Is that?
Yeah, it's almost anticlimactic, but we've been making it back into a day patient unit and moving all the intensive care stuff out. We're doing that in a way that we can reinstall it as an intensive care within 2 days, should we need to. So we know exactly what goes where, which piece of equipment's being stored where, and we can do that in a very controlled way. So we'll be putting people into the day patient unit, I think, on Monday, actually.
Okay, thank you. Any more?
Sorry, I'm in the corner this time. Obviously, you were originally planning on entering phase 3 next week. A lot of takeaways, as an example, would have been mentally probably thinking, hopefully that's the date. Was there a decision behind giving businesses less than 24 hours notice in that might maybe have a slower reopening? Or is it just that you've made the decision now, you want it open sooner rather than later? I don't know whether it's a smaller scale issue, but not giving people much notice, whether that was intentional or not.
No, it's purely because of looking where we are now and saying, businesses don't have to open now if they don't want to, and if they're able to, that's fantastic. And we've had information about where certain businesses are at the moment anyway. I think some can start. I think it'd be harder for some in terms of their supply chain. And I think a lot of businesses have been mentally prepared anyway, that things will change, and lots of them have put through what we call method statements about how they would operate. So I think a lot of them are chomping at the bit to be able to start anyway. But no, this is purely because the evidence has shown such a fantastic position that we thought, well, we shouldn't, in terms of proportionality, keep things locked down where they were for any longer than they needed to be.
And we've mentioned the method statements before, and it's worth putting that message out that for those businesses that aren't yet able to trade, that they are encouraged to engage with public health, with environmental health, and with health and social care to start preparing and thinking what would be required.
Absolutely, and it's been really interesting seeing those businesses being very proactive. I mean, we've had the same come from hairdressers as well. If they know that it's not going to be till phase 4, but they're starting to say this is what we can do, and it's fantastic, and that all helps make things work far more smoothly. So I do appreciate that.
Easier for you.
Absolutely, it's not all because all this. It's not just about government saying this is what you do. I know I sit here and do it from that point of view, but it is working with businesses and others to say what will work, and it's getting that, as I said in a previous press conference, it's that two-way conversation. It's for all of us to make this work, and we really welcome all the help we can get.
All right, thank you. Yes, Ewan.
We just have a quick word about schools. I know you said we'll have an update a bit later on, but what kind of modelling are you looking at? And is this one of your biggest challenges you're going to face in terms of how you get the children back? And are head teachers all in agreement of how that's done?
I'm not sure I'm in a position to address and answer that question now. I think that's probably a question that needs to be addressed to education next week. I didn't know if you've
absolutely, the sort of reinforcement of my message that a huge amount of work is going on behind the scenes. Engagement with the unions, engagement with the teaching staff, working with the heads, working with the staff that work in the central office for Committee Education, Sports and Culture, and of course the committee themselves in what is proportionate again, how can it be done safely. And that's all been worked out, which is why I think sensibly they've given themselves just a slight little bit more time, opening on the 8th, which is a week after the half-term, the predicted half-term break. And that is principally and also so that they can work out those procedures. And once that's all done, obviously communicate those in a calm and effective way rather than do it in a compressed sort of 5 or 10 minute slot in this particular panel session. There will be a dedicated one of how that's put across to the community.
And again, I think going back to a previous question, it is important that is done to build confidence that everybody involved. Obviously, parents are going to want to be anxious and concerned that they're sending the children into a safe environment, and teachers want to be sure they're working in a safe environment. So it does, hence the time. And I think it's also Guernsey is not unique in addressing that challenge. Clearly, every jurisdiction is trying to work out what the appropriate and safest way is, given their own circumstances. Any other questions? Go on then. Yeah.
Go on. Just lastly, I'll round us off. Dr. Brink has said. Dr. Brink has said that we are exceeding expectations. You've outlined in the last press conference the weeks and the stages until we get to the next one. Obviously, you've said it's a living document. We know that things will get moved and updated as we go along. Are we looking at less time before we move to phase 4, or too early to say until we've been into phase 3 and figured out what's happening?
So potentially we're looking at a less time, but we need to be absolutely clear that we will be guided by the evidence. We will continue testing, and bearing in mind we're starting to test new groups of individuals, we need to see what comes out of that. So we're in a very good position. If we remain in a good position, there is always the potential for that. We always said we could concertina the phases, which is why we called it a framework, because we didn't want this to be tablets of stone, but we felt we needed to give people an idea of where our thoughts were. And that's been what we've done throughout. We've said this is what we're thinking, but it may change. And I think people can understand that, So yes, if it continues going well, we could concertina it down, but we'd want to be absolutely sure we continued in a good place. We don't want to compromise we don't want to be complacent, and we don't want to compromise what we've gained.
Heidi?
Yeah, I don't know if the phrase "don't run before you can walk" is one to use here. Yeah, it's been brilliant. I just wake up in the morning and think, I can't believe we're here. And I feel, I like Gavin, just waiting for the daily briefing to come through from Nikki to say how many cases there are. And just like you click on the button and go, oh, phew. And it just somewhat feels rather surreal at the moment. And we'll have a test of this by easing the lockdown. That's when we might more likely to see any cases come up. So we can't make any promises. Everything's been fantastic, but we can't make promises. Clearly, what we will say is if the evidence shows that we can release lockdown sooner, we will, because it's all about being proportionate to the risk that is impacting us. But yeah, let's just take it easy. Just don't be complacent. Just really follow Nikki's guidance. Listen to Nikki. She's been right so far. That it's the best thing to do is to follow the current messages and just don't be complacent. And we will be able to get out this sooner rather than later.
Under promise, over deliver.
Yes.
Okay.
Thanks, Gavin. I'll finish up. I think one of the plus sides of being having lockdown and people being at home is seeing more nature, enter our gardens or in the countryside. And I understand the Pollinator projects have been working with Guernsey Mind to build on that. And so people get a door drop, I think it would be from Monday, just helping people get more knowledge about what's out there. And so this one's all about learning about the butterflies in the community, which is fantastic. It's a really beautiful piece of work, actually. Excellent. And I think there's a butterfly competition as well to create a Guernsey butterfly. So well done to the Pollinator Project and Guernsey Mind for doing that. So I look forward to seeing it and seeing what we can do with it. And just I hope people can enjoy it and take on board what they've done. Thank you.
All right, thank you very much. So with that concludes this week. We'll plan to meet again this time next week, next Friday at 1 p.m. And in the meantime, stay at home as much as possible. Thank you very much indeed.